Welcome to this video. My name is Pedro Rodrigues Ribeiro. I'm a psychologist. In the field of psychology and psychotherapy in particular, with all these questions and all these last months with COVID and the pandemic, psychology and psychotherapy were forced into online practice or to evolve and adapt to online practices. Now, that's not to say that online practices didn't exist before COVID. That's not true. Psychology and essentially psychotherapy were utilized in online practices in certain cases, specific situations. For example, when someone who is in a psychotherapy process, in the therapeutic relationship, when that person may move because of working situations or to improve her or him or his quality of life, the person may ask or may want to continue to be in therapy. And if so, one of these services that most psychologists and most psychotherapists would provide is online sessions with Skype, Zoom, or other online platforms. So in these specific cases, online therapy was utilized, was a current practice before COVID. Now, with COVID and the pandemic, especially in the stage of the pandemic where everyone was confined into their homes, online therapy was the solution for most therapists to continue to work and to continue to support their patients and their clients. So online therapy was a common practice and still is, because COVID is still here, and sometimes depending on the countries, we can change between phases where we are in confinement and phases where we can do some presential work. But online therapy is still the one of the main interventions. And because of this, in recent months, a lot of research in online therapy efficacy was produced into scientific journals, and a lot of models and a lot of therapy process were validated as efficient in online format. So much that in some countries they are viewing online therapy as the future. So in the future, all therapy processes will be via online or in online format. Because, let's face it, we have certain advantages on doing online therapy. One of the one of the advantages is we can spend less resources. For example, I spend less gas and less miles in my car in driving from my home to my workplace. So if I have a good connection, a good internet connection at home, and if I have a study or a room that I can have some privacy, well, I can do online therapy. So I'm saving money in gas in my car, and still I'm being paid to do what I usually do, therapy. So that's a bonus. Another bonus is I don't have to worry myself with going, or my worrying in my work schedule. For example, I don't have to plan to wake up 2 hours before or 3 hours before, depending where I live and where is my workplace and the traffic and all those conditions. So if I'm at home and if I'm doing online therapy, I can have more time to prepare myself to do things slower, to enjoy some breakfast or enjoy my coffee, not to do all those things in a running speed, so to say. So that's a plus. And I can reorganize my schedule in a different form. I can in reality, I can have more sessions per day or per week than I can have in the present or presential form, because I have to have more breaks between hours. And in the online format, well, it's more easy to work with someone at a scheduling in scheduling, not only by days, by hours. I can have sessions on weekends if I want to, and even if I'm going in a different city or in a congress or something. If I have internet and if I have my computer, I can arrange an online session if someone really needs to have that session. So I have more flexibility. The downfall of online therapy, there are a few points. First, for the most part, a lot of clients can't really assure some privacy or some hours that they are in a quiet place. So, for instance, if you have a session with a man or a woman who have a family, the risk of someone banging on the door or opening the door and entering without warning, it's very high. It's realistic. If you are working with children, certain online practices may not be so so efficient. For example, play therapy. It's true that you have a lot of games that you can interact with the child via computer or via chat, or like for example, you can utilize Sims as a way of doing a session. However, there are they there are certain practices that aren't really adapt for online therapy, especially with young children. For example, 5 years. So they are very young, and online therapy may not be suited for them. Another point is obviously the cuts that you may have on your online session. A lot of colleagues may experience this situation. You are in a session with your client. You are doing some therapy process, and suddenly your internet signal spiked. So your audio becomes unstable, your image froze, your webcam starts to froze your image. We all been there, and that can be an issue, if an issue that you really can't control most of the time. And finally, one of the most important downfalls is that not all therapeutic strategies or not all techniques are adapted and validated for online therapy. For example, chair work. If you are an experiential therapist, like for example Gestalt or emotion focused therapist, or even if you are a CBT practitioner and you like to do some chair work, well, online chair work may be difficult to set up all the chairs and to really guide the client into that experiential process, and even some techniques that work in online therapy. For example, mindfulness, relaxation techniques, or even some hypnotic techniques. I suspect that the strength of the technique or the strength of the approach may not be as strong as some present work. Or if I'm hypnotizing someone, if I'm close to the person, it will be more strong, more efficient than online therapy. So it's downfall. It's a downfall. We can think at online therapy in this way. If someone asks specifically for online therapy, and if their characteristics are suited for online therapy, you can do online therapy. Why not? It can be a strong resource, especially if someone lives very very far from you or from your workplace. So in that way, online therapy will be a nice and suited strategy that you can do. If someone asks for presential sessions, if they are more suited for working with you in a close manner, with some secure measures, of course, especially with COVID. If you are able to do that with the client, if they want, if they prefer, then I would say that working closely with someone can be more efficient than online therapy. It's all in a matter of what the client prefers, what is more suited within their characteristics. And obviously, if you are comfortable in doing online therapy, or if you are only comfortable in doing online therapy. So these are my thoughts. I hope that they have some usefulness for you to think and to contemplate on them. I thank you for your time, especially nowadays with all these situations. Please be safe and healthy. I'll see you next time.